Canine chiropractic care. Chiropractic care is an alternative method of healthcare that is a drugless method. It doesn't replace traditional veterinary medicine. Chiropractic care deals with the nervous system that is housed inside the spinal column. The spinal column carries all the nerves that go to every organ in the body. These nerves exit the spinal column through vertebrae, which are the individual spinal bones. Chiropractic maintains that adequate nerve supply is vital to the proper functioning of the entire body. Modern medicine has determined that the weight of a dime placed on a nerve will decrease its transmission by 50%. When the vertebral bones are misaligned, even very slightly, they affect the nerves and the flow of nervous energy. Chiropractors call these small misalignments subluxations. A chiropractic adjustment is aimed at correcting the subluxation and restoring the proper functioning of the nervous system. Chiropractic thus works to eliminate the cause of the problem and not just simply treat the symptoms. Canine locomotion can be compared to a symphony orchestra playing a composition. All parts must blend into a harmonious pattern, from the gentle sway of the head and tail for balance to the coordinated effects of each limb and body muscle to accomplish its special function. Conversely, also like an orchestra, if all movements are not attuned to the whole, a major fault should be evident. Roy, 1971. The hind limbs are the motors of locomotion and drive the trunk forward. Where the head goes, the body will follow. Energy is generated when your dog brings its hind legs under it. When motion is generated at the rear of the animal, it travels fluently to the front like a wave. When the motion is interfered with, so is the motion at the front of the animal. You can use a food treat to get your dog to voluntarily turn its head and show the range of motion. The treat should be held at or near the shoulder. You can check the length of your dog's back legs. They should be at the same length when your dog's spine is straight and should stay the same length when their head is turned each way. Subluxations in the head, neck, or pelvis may cause one leg to be shorter than the other. When your dog may benefit from chiropractic care if he or she exhibits one or more of the following problems: decrease in level of performance, laziness, the nervous system supplies the body with energy, behavioral problems, problems or difficulties executing desired movements, climbing stairs, jumping on the couch, agility obstacles, problems eating or refusing to play with toys, short striding, uneven strides, nail dragging or stumbling, muscle imbalance, spasms or atrophy, diagnosed conditions such as degenerative arthritis, abnormal posture when standing, standing with hips uneven, choosing to stand on uneven ground, not squaring up when urinating, or holding tail to one side, shaking of the head, constant ear problems or allergies, injuries resulting from falls, training, or other activities, chronic disease conditions, multiple repetitive infections, or weak immune system. The dog's spinal column has over 100 separate joints. Each of these joints must function correctly for it to perform appropriately. The amount and direction of spinal movement is determined mostly by joint size and shape. The neck and tail are the most mobile regions of the dog's spine. Limited back movement occurs in up and down motion, side-to-side motion, and rotation. When a dog loses its normal range of motion in one or more of these joints, there must be compensation elsewhere. Compensation may result in an altered gait. To return the joints of the spine to the normal motion, an AVCA-certified chiropractor will perform an adjustment on the area of the spine affected. A complete chiropractic examination includes taking a case history. What does your dog do? When did it start having problems? Posture analysis. Does the dog have any problems when standing still, or only when walking? Static and motion palpitation of the spine. Chiropractic adjustments are specific, low-force, high-velocity adjustments aimed to correct joint misalignments and to restore proper skeletal movement and muscle nerve function. The movement within these joints is minute, and therefore the adjustments by the chiropractor will be small but significant. Canine chiropractic adjustments are aimed to adjust one joint at a time and not the entire animal. Chiropractic care takes time, since we are allowing the body to heal itself after the proper nerve functioning has been restored. Animals recover very rapidly as a rule, but older animals and more serious problems take more time. Some problems are so serious that chiropractic will not completely solve the problem. Sometimes referrals for laboratory analysis or radiographs may be necessary. This is the case when problems such as fractures may be present. The speed of recovery depends on several factors. The length of time that the problem has been present. The more time that has elapsed since the onset means that the recovery may take longer. It takes time to get sick, and it takes time to get well. Age and physical condition of the animal. Older animals are slower to heal. It's not possible to return a 17-year-old pet to a youngster, but the quality of their life may greatly increase with chiropractic care. Damage. Sometimes there is simply no repair for severely damaged tissues. For example, if the spinal cord is damaged by a ruptured disc, there may be slow and minimal healing with any treatment. Cooperation. The speed of recovery often depends on how well the owner will cooperate with the animal chiropractor who is treating his animal. If the animal is removed from care too soon, the best possible results may not be achieved. Contact an AVCA certified chiropractor today to get your dog started on the road to better spinal health.